Good afternoon, Team Ivy. My name is Danisha Posey, and I serve as the Vice President of Diversity, Equity, and Belonging here at Ivy Tech Community College. Welcome to a week program entitled The Intersections of Diversity, Equity, and Belonging in the Wake of COVID-19. This weekly Lunch and Learn series will be scheduled each Tuesday in the month of June to understanding and to learn to build an understanding of the different experiences of our students, our employees, and our communities during the COVID-19 pandemic, and offer ways to build a better sense of belonging here at Ivy Tech. Today's topic is a very important topic and one that has personally affected my family. 61 days. My dad was rushed to the hospital on March 26 with shortness of breath, brutally painful joints that he couldn't even walk, and overall body pain. He was diagnosed with COVID-19. 2 days later, he could no longer breathe on his own and was placed on a ventilator. He stayed on a ventilator for 6 weeks, unable to see, touch, or hear from his family because of the strict hospital guidelines against visitation, as we were right in the height of the pandemic locally. My dad finally woke up, got off the ventilator, and came home on May 26, 61 days later. I would be remiss if I didn't acknowledge those in our Ivy Tech community that has contracted this virus. Let's take a moment to reflect on our families, friends, and colleagues that have suffered from this virus in different ways, whether it's personally, through their family or friends or others. COVID-19 is affecting African Americans in alarming and disproportionate ways. African Americans are contracting and dying from the virus at higher rates than many other populations. Today, we have the privilege of hearing from Dr. Virginia Caine as we dissect the intersections of diversity, equity, and belonging in the wake of COVID-19. Virginia Caine, medical doctor, is a director and chief medical officer for the Marion County Public Health Department. She is an associate bicentennial professor of medicine at IU School of Medicine Infectious Disease Division. She is chair of the National Medical Association Infectious Disease Section and board member of the CDC Morbidity and Mortality Weekly Report Editorial Board. She chairs the Managed Emergency Surge of Healthcare Coalition, a nonprofit public-private partnership addressing emergency preparedness in Marion County, Indiana. She is a member of the National Biodefense Science Board, which provides guidance to the Secretary of the U.S. Department of Health and Human Services and the Assistant Secretary of Preparedness. Quick housekeeping. You are all on mute for the duration of the session. If you have a question for Dr. Caine, please type in the chat and I will attempt to get to as many as I can during the session. I will be monitoring the chat, so don't wait until the end for your questions. Also, this webinar is being recorded and will be posted on our YouTube channel for additional viewing. Without further ado, I'd like to introduce Dr. Virginia Caine, and I will spotlight her video. There we go. And you are muted, Dr. Caine.
Hello. Oh, unmute yourself. Okay. Am I muted? Hello. Can you hear me?
Go. You are
okay.
Good.
Good. So I want to just thank you for this opportunity of coming to talk to you and give you an update on the coronavirus, and also to inform you about some of the issues that are facing a lot of our vulnerable populations, especially from a racial and minority standpoint. So thank you for this opportunity, because it has been very challenging for our different populations that are occurring in Indiana. As most of you know, Indianapolis has reached over 10,000 COVID cases, and we've had nearly 700 deaths as a result of this coronavirus. And when we look at the statistics, and I don't know if, Denisha, I can have you present that first page or presentation for me. If you can bring that text up, I don't know if we can see it. Okay, so if you can go up just a little bit higher at just the top part right there. So one of the things that we look at when we look at our demographics here in Indianapolis, African Americans make up nearly 28% of the population in Marion County. But when we looked at the actual number of cases, we found out that African Americans had 3 times as many cases as their white counterpart. So they had 290 cases per 100,000 African American residents compared to only 97 cases per 1,000 white residents. And then we'll go down a little bit slower. And if you can see that first graph, if I can pull it up a little bit, you will also see that when we looked at hospitalizations, that African Americans were at 2.5 times higher in their hospitalizations compared to their white counterparts. And then when we looked at the deaths, they had nearly twice the number of deaths from a mortality standpoint compared to their white counterparts. And let's see if I can go down a little bit lower and see this graph where we're looking at the ages. And we see that the hardest hit population in terms of breakdown of cases is associated with the age, okay? Is the $100,000 correct? Yes, that's correct. So, so when we looked at the risk of death, if you were between the ages of 20 and 44, we only had 1 death between that age group for our COVID-19 up to the date of this report, which is like in May. But when you looked at how many died who were over the age of 65 and older, 73 deaths occurring per 100,000 Marion County residents. And if they were over the age of 85, 217 deaths occurring per 100,000 persons. So the total population for Marion County is roughly around about 986,000. So these are the deaths that are occurring per 100,000, so that you see and look at who are our highest risk populations for contracting this infection are different racial and ethnic populations. Anyone that's 65 years and older, and you're even at a higher risk if you have an underlying chronic medical condition, such as heart disease, diabetes, you've had asthma or chronic lung condition, or renal failure, put you at a much higher risk. And we cannot forget our folks who are immunocompromised, someone who may be HIV infected, or someone recently undergoing cancer treatment, and even patients that have just like rheumatoid arthritis. It may be so severe that they're put on medications that suppresses the immune system significantly, that can make you more vulnerable to getting the coronavirus. And so major issues for our population. And let's see, I think, and if we go down one more further down here, when we look at our death rates and just looking at that first table, African Americans have twice the death rate compared to their white counterparts. And so It's a tremendous issue. Now, when we look at gender, we find it's almost even number of females having the same cases as their white counterpart, but we find a much higher death rate in males compared to our white females. So we're not sure what that means or whatever related to that. But from a community or a large metropolitan city, this is very similar to what's happening across the country. We saw that in Chicago, African Americans made up 68% of their coronavirus cases. So now, I got if you don't, I can answer some of the chats as they're coming on, if you don't mind. So it says, why does it appear that African Americans are at higher risk for contracting the coronavirus? So let me say that, believe it or not, I think poverty plays a role, but also when you look at the paying jobs that we have, on the low spectrum of the 10 lowest paying jobs, African Americans make up the highest percentage of 8 of the lowest paying jobs. So they have the type of jobs that they're on the front lines, that they have to be out in the public. You know, they may be bus drivers or janitorial services for facilities. So it's a significant percentage of us are frontline workers, so that they don't have the luxury of being able to telecommute at home. So as compared to someone who is a higher income bracket and has a different type of job. So they're at a higher risk because they have greater exposure to individuals who may have the coronavirus infection. And then secondly, that's an issue. We have a higher percentage of underlying chronic medical conditions with heart disease and hypertension. We know that from a genetic standpoint, there's a higher rate of hypertension in African Americans compared to their white counterparts. But also other conditions, we have much higher rates of diabetes. We may have a higher rate of asthma because we may be living primarily a lot in more inner city areas where there's a higher concentration of industrialization. And so the air pollution from living in places that has higher industrialization can precipitate or impact that asthma compared to if you're maybe living out in the suburbs and there are less industrial buildings out there. So a number of major factors, but probably then the other one that's the most important is their lack of access to healthcare. So that by the time they are diagnosed, it may be late when they're getting into the healthcare setting. If I don't have any money, so I got to make the decision whether I am going to pay my rent, will I have food on the table for my children, or should I go to the doctor? So they try to see if they can self-medicate themselves or try to avoid going to the doctor as late as possible. So they're at a much higher level of severity a lot of times of their condition by the time they are seen in the healthcare system. But there's a significant percentage that don't even have a primary care provider. So, and a lot of times they're told, hey, you just probably have the flu, don't come to the emergency room, you know, unless you're real sick. And so a lot of times they may suspect they have COVID-19, but sometimes they're turned away from the emergency rooms. I had a young Latino patient who had was sick, fever 102, and flu, you know, a lot of muscle aches and coughing and whatever, and wanted to have the ambulance pick her up, but they chose not to just say, why don't you monitor yourself for a couple of days, and if you're feeling really, really bad, then call us. And so I got a call from the owner to say if there's any kind of way we could get this young lady tested. And actually I had to we sent a nurse practitioner to this young lady's home and tested her. And of course she had COVID-19. And then you have to realize this is where something called contact tracing. I know some of you may have heard about this, but this is so important because it turns out she had people in the household where she had infected another member, and he was sick and had gone to an urgent care to try to get the COVID-19 testing and spent $100 to go to the urgent care, but he did not have a fever. And so they chose not to test him for the COVID-19, and that's what he went to get tested for. And so I'm also highlighting the point that, you know, fever is not a necessary component in everybody who has the COVID-19. So a lot of times, even from our healthcare workers' standpoint, we may misdiagnosing someone because we think fever is a component 100%, but in reality and actuality, it is not. So we ended up testing her sibling, who was also positive for coronavirus. But the importance of this is that there were young children in the household. Sorry about my cat. Let me. I apologize. Hold on. If you let me see if I can move him to another place. Hold on. Hey, baby. Hello. No. Stop. Oh my goodness. Sorry about that.
This is real life. This is real life.
I'm sorry about that.
Home.
I apologize. Well, I'm gonna hold on 1 minute. Hold on. All right. Hold on.
And for everyone who's writing questions, I am typing them down to be added to my list of questions that I'll be asking when she finishes this question up.
So the importance of this is that we were able to move all the other members out of that home and also prevent, you know, young children from being infected, or anyone that's a senior that was in the house. And you have to do this quickly, because if you don't do it quickly, then you can infect all the other members in the household. And these were members that work out in public. So it's quickly, you have to be able to self-quarantine them for at least 14 days. And that's the importance of contact tracing, that you go back for 14 days of whoever they've been in contact with, test them, and also say, listen, I need you to self-quarantine for 14 days so to prevent infection spreading to other individuals. So I'll take questions.
Okay, so first thing I want to just clarify, earlier you said 290 cases per 100,000 African-American residents versus 97 cases per 100,000 white residents.
That's correct.
Okay, perfect. All right, so now we'll go into some of the questions. Well, you've answered my first question, but my second question is, what do we know and what don't we know about the virus?
So I think here's the biggest thing that we don't know about the virus, and that is when you are older over the age of 65, that we're finding that the virus will shed for longer than 30 days in individuals, and some are going up to even 40 days. So the question is, after 14 days, even though they have the virus still remaining in their body, is it still contagious? So I may have a virus still present, being isolated from my system, but it may be dead virus particles and not necessarily active infectious particles that are spreading disease. And this is important because, you've got someone, oh, I've been in isolation for 30 days because I'm still having active virus identified, but they may be dead particles that are being identified and not necessarily active particles. So that's the piece we really don't know well. I know NIH is desperately trying to do a study looking at that, and some other academic centers that we're looking at. So that's a really huge piece. We also know that people have been very interested in the antibody test. That's a new test where when anyone has an infection, your body will try to manifest a immune response, and it develops proteins, which we call antibodies, that will help fight off the infection. But sometimes your antibodies are not enough to be protective or prevent you from getting the infection, and so sometimes you may need antiviral medications along with it. But these antibodies, depending on the type of antibodies, there's antibodies called G antibodies. They can last for up to a year in a person's system. So you may say, wow, I was really sick early January, and they thought I had some kind of viral syndrome, but none of the tests could tell them, what I had, but all the symptoms like a virus, and it lasted weeks. So an antibody test, if you did it now, could tell you that you've had a past infection with COVID-19. I may not be able to tell you exactly when it occurred, but I can say you were exposed to COVID-19 and you actually got an infection. Now, they're supposed to have two types of antibodies where they're supposed to be able to tell you that you're in the active stage of your infection versus we know you've had it in the past, but it's not active now. And so maybe 50% of the antibody tests are looking to be accurate, so I can make the difference. But at least personally, the testing that we're doing through all of our testing sites, the majority of them are what they call a antigen test. This is a special particle, virus particle, that's an active component of a virus that tells me I've got an active infection going on right now. So, so important to really know that you got an active infection, because we have to do the contact tracing if we're going to be successful.
How has this pandemic shifted the conversation around equity in public health?
I think it's really shifted the conversation greatly, because unless we address the health equity, and I'm talking about not so much from a racial standpoint, but I'm looking at those major underlying factors that makes us more vulnerable to this coronavirus and contributes to the spread of the coronavirus and morbidity and mortality, utilizing our hospitalizations, our emergency rooms, and that is, we have to address poverty. I think poverty is our number one issue. So if I was financially able, I could seek and get that information from my primary care provider. I could get better education related to what I needed to do for prevention. I could maybe afford those products to help me protect myself. If you got low poverty, you might not even be able to afford to pay for a mask or have enough antiseptic materials in your homes to disinfect everything. And so where am I going with this? We have been on living wage, minimum wage that we pay, $7.25, I think it is, for 15, 20 years. We have not raised minimum wage. But inflation goes along. Hey, my rent has gone higher. Utility bills have gone higher. The products that I buy have gone higher. So that is forcing a lot of families to have at least 2 jobs. And you say, well, what's wrong with that? Well, if you're a single parent and you've got children in the home and you're working 2 jobs, I think it can be extremely challenging for that single parent to help to be able to do the education for their child, be around for that child for good activities. And so we need to strongly think about raising our wages to the living wage. So living wage means that you're making enough money to put food on your table, pay your rent and utilities, and you can do transportation. So that's the goal that I think we really need to reach, or it's just costing us on the other end from a medical standpoint. But we need to really work on this health equity. We have to have resources going to those areas in order to provide education, provide the resources in order to help them. Because not only do we have vulnerable populations, we have to think about our homeless population that's associated for maybe a third of them having some type of mental health issue. But, you know, they are in large shelters, very enclosed, and I'm talking about up to over 500 people, and you get a couple of them infected, then they can infect everybody, and you have a significant number of hospitalizations coming from just one huge homeless shelter. Or talk about what happened in Ohio. They had a prison of 2,500 inmates, and 1,900 of them became infected. So you know, what's the chances of those remaining inmates, 600, not becoming infected? And you know, it's a nightmare to have an inmate say, hey, I'm sleeping next to, these folks are coughing all over me, and I know I'm going to, just a matter of time before I contract COVID-19. So we have to have good infrastructure. You know, we have to look how we're building new jails. Do we have great isolation rooms that we can move our folks who are infected and isolate them? So there are a number of issues that this effort has really identified in terms of our vulnerabilities from an infrastructure standpoint. Do you know that Indiana ranks 48th in terms of funding for public health, what we pay for public health resources to do the things that we do? We're 48th. That means 48th worse in terms of what we spend on public health resources. Now, I'm providing free COVID testing. Free. It costs me $62 a test. I'm providing it. If I do 200 tests Monday through Friday, that's $250,000 for me a week. And I'm doing about 400 tests a day. So you're talking about $500,000 a month that I'm spending in order to try to bring free COVID testing for vulnerable populations who don't have a doctor, because some of the sites, and I will always compliment Lilly Incorporated, Lilly Pharmaceutical Company, how they stepped up to the plate. My God, we're in a wonderful city, did a remarkable thing where they provided free testing to our healthcare workers, provided free testing to our first responders, and then they went to provide testing for folks who are daycare workers and elderly care workers, and then started to help anyone working in grocery stores, and they provided it free, but you had to have a doctor's order. You couldn't get tested without a doctor's order. So we set up our first testing site at the Indiana Fairground, the Marion County Public Health Department. And we said, hey, I'm going to be the doctor. So you don't have to get a doctor's statement in order to get the testing, and we will make it available to you free. And then we've just had some tremendous partners that have stepped up to the plate. Kroger's has come along and has partnered with us. IPS in their schools, 90. Warren Central High School has stepped up for a site. And our very first community site was at Eastern Star Church location under Reverend Jeffrey Johnson. So forever grateful for them to stepping up to plate to let our first community site for anybody that needed to be tested was available there. But we've had Kroger's, Orange Central, IPS, and we're racing now, because we have a site at the Indianapolis Motor Speedway, helping us out. But we have about 8 or 9 hot spots throughout Marion County. And so we're trying to get testing at all of those hot spots, especially where we have Latino populations that may be disadvantaged and don't have access to sites. So it's a big challenge, and I just have to thank the leadership of Mayor Hotsett for working very closely and trying to help identify resources out there for us.
Thank you. I'm gonna put 2 questions together that I've found through the chat. So as communities begin restrictions, and as we've been seeing the peaceful protests across our state and across the nation, how do we remain vigilant to avoid a second wave and to make sure that those that are out there together stay safe?
I think we have to be definitely concerned about the fact that it appears as though we're having a lot of out-of-state individuals come into our communities. And I looked at some of those television videos of our protesters coming into our community in large crowds, and a significant number of them were not wearing masks. So you have to be concerned about that. You don't know where these protesters are coming from out of state, and they're not following social distancing or wearing masks, that it could result in a second wave. And we've just been doing wonderful, tremendous, in terms of our family having to stay in place, sheltering. We closed all the school systems down. And, we've been very cautious in terms of our reopening plan, our process. We delayed our reopening compared to the governor and the state, because we were looking at our numbers and just saying, just from abundance of caution based on our numbers, we want to be very careful how we reopen it and trying to use evidence-based data in terms of helping to make our decision. But you will see that our number of hospitalizations have declined significantly. Our emergency room visits for COVID-19 has declined significantly. And then when we look at our positivity rate, we're testing people, what percentage of them are positive? We started out with over nearly 50% of them positive when we were first testing, but of course they were the sickest and going to the hospitals. But our positivity rate has dropped significantly, under 20%. So we're definitely going in the right direction. And so I just pray that we didn't bring additional infection into our community related to that when they're not taking and doing the preventative stuff. I don't mind them coming as long as they are doing their social distancing and they're wearing their mask out in public in the air. Now, the advantage is this was outdoors as compared to being inside a facility. So you have the air ventilation from the wind and whatever that helps tremendously in preventing infection. So we'll just have to monitor to that and see where we are in a couple of weeks.
Okay, I got another couple of questions that I'm gonna kind of combine.
Okay.
How much should we be doing to prevent the virus from entering our homes on grocery bags, clothing? And is there a higher or equal concern with the virus carrying on surfaces?
So we know that virus can be carried on surfaces. It looks like it's on surfaces for a matter of like 1 to 2 days. That's possible. But we have been able to do studies like with the post office. We've never been able to identify a case from anybody receiving mail from someone in terms of the surface, but sometimes it also depends on the type of surface. So it is so important that you have to frequently wash your hands, and you need to disinfect your home every day. Remember, if if you do grocery shopping, I know they do a great job in the grocery stores of wiping down the handles, but anytime you go out into community and you touch any surface, have those hand sanitizers available, greater than at least 70% alcohol, and clean your hands. And don't forget, if you drive a car, you open up your door handle, so wipe those down too. Frequently touch surfaces, wipe them down.
All right, here's another question. Are there things people in better socioeconomic situations can do to assist our neighbors in underprivileged communities, keeping in mind that we're finding it hard to find cleaning and disinfectant supplies, so donations are not really a viable solution? So what can non-medical professionals do to help in this time?
So I think the number one thing I'd be the most concerned about is, are you aware of any senior, an elderly person, and they may be alone, may be difficult for them to get resources. So you may belong to a civic organization, or you may belong to a faith-based community, or even we have a lot of homeless shelters where you can donate your resources to, or and there are a lot of social service agencies that could benefit from giving those dollars, but check in on them. If you can identify seniors in your neighborhoods and just making sure, hey, do they have the ability to go and get some groceries or some assistance to help them go and pick up their medications from a pharmacy? I was heartbroken that the protesters destroyed the CVS pharmacy downtown. And that was a place where a lot of our seniors could go and get their medications. And now some of these seniors are going to be forced to try to find the dollars just to get the cab fare to be able to go to another facility. So, but please call us. United Way, with a lot of our philanthropic foundations, have been providing resources out there, but we always need some help, and we always need some volunteers. So think of some way to help people in need.
All right, so I have a couple of questions that revolve around the antibody test. So
Yes.
How can we get tested for the antibodies? Is it easier than the other test? Do you need a prescription?
So the antibody test is a little bit different than the antigen test that we started out. So the antigen test, that's the one we do, and most places started out doing, and even the State Department of Health provides these testing. Those usually require a nasal swab, and they will place that nasal swab inside your nose, kind of deep back there. So it's a little sting, a little bit. And some of them require 2 swabs where they put a swab at the back of your throat. Now that's the viral antigen test. Now for the antibody test, they need a sample of blood. So they'll take a tube of blood from you in order to do the antibody test. And we know that there are 1 or 2 antibody tests that are being done at Indiana University School of Medicine. So if you want to participate, contact me at the health department and I can provide you where those studies are done, and if participants are interested, we can refer you over there. We're working on a lot of tests though. I know Kroger is partnering to look at a test where they're looking at saliva, where you can just spit into a tube and hope that they can diagnose the virus from that mechanism. We also are looking at a urine test. I know from IU School of Medicine and the radiation therapy department, they're trying to use, just give a sample in a cup and they can get your results back. And so these are sort of some of the less invasive tests that are ongoing right now. So we're hoping to have a really simple test, and we can't wait for us to bring in what we call a point of care testing. Point of care testing means it's a test that you can do in the doctor's office, and you can get your results in 30, anywhere from 15 to 45 minutes. And so we're trying to research that right now, trying to hope to bring that type of tool to our primary care providers' offices where it's not so cost prohibitive.
Thank you. Do we know if the COVID-19 virus is expected to mutate into another version that current experimental vaccines will not have an impact on?
So let me just say this. Most of the influenza viruses, they mutate. They are really smart cookies. In this particular version is a mutated strain from the coronavirus that causes the common cold. So in the family, everybody has the common cold, and the family is called a coronavirus. So this coronavirus has transmitted in the past to something called SARS, if people remember that, and even another virus called MERS, M-E-R-S, that we saw in the Mediterranean area causing pneumonia. So this will be sort of like the 4th mutation with this particular strain, and yes, these viruses are becoming, these pathogens are becoming so sophisticated, very smart, that yes, it can undergo a mutation. Usually it takes about a year though. It's not a fast process, but it can occur definitely. And we have to be very concerned about getting it right in terms of the vaccine for this particular strain. And that's what happens with the influenza strain. We have 400 experts across the country that are called down to CDC to review data and evidence to try to suggest what should be in the vaccine for the flu. And some days we've knocked it out of the park, the vaccine, but we had 1 year where the efficacy was 18%. And so you need to have that efficacy at least 60% or higher, and you feel really good about it's doing a great job of protecting people from the flu. And even if it doesn't protect you completely from the flu, it gives you a milder version of the flu. So you're not at risk for being hospitalized, and you're not at risk from dying from the flu. So we've got our work cut out for us come this fall, because we're going to have the double whammy. We're going to have both the influenza and probably COVID-19 going on at the same time. What does that mean? Your hospital beds may be so overwhelmed because now you've got both entities occurring in our emergency rooms and hospitalizations.
Is there a lower number of hospitalizations and cases reported because of the lack of access to testing and being turned away from healthcare providers?
I'm sure that our numbers were lower because one, the lack of availability of the test at the beginning of this epidemic. So I'm sure our numbers are underrepresented in almost all categories, but we're praying now that because we've got expanded testing and we still have a ways to go, where we're still not just testing anybody who just wants to test. We're trying to really focus on if anyone is symptomatic, that's who we'd like to test, but you don't have to have any symptoms whatsoever. If you're over the age of 65 and you want to be tested, we're happy to test you. Anyone who's immunocompromised, you don't have to have any symptoms, we're happy to test you. And if you give us some extenuating circumstances why you feel you need to be tested, I'm sure we wouldn't turn you away.
That's great to know. Let's see. Which is the better method of killing the virus on our hands? Basic water or using hand sanitizer?
So I'm sorry, tell me which one now?
Basic soap and water or using hand
So
sanitizer?
actually soap and water is the number one. So it's way more effective, but you got to wash your hands for at least 20 seconds. Okay, if you're just a quick wash, it doesn't do the trick. So that is much better in eradicating the virus. But then the hand sanitizer is the second most closely affected mechanism, but all hand sanitizers are not alike. So you have to make sure that it says it's got at least 70% alcohol in it.
Would you happen to know what the recovery rate over 35 years of age is?
So I know that the recovery rate, I have to try to remember that table, but it's been very, it's way better at the 35-year of age. The recovery rate is probably over, I want to say it's probably over about 85%, but we have been seeing recently a younger population that if they've got some chronic medical underlying conditions, it can put them at risk. For example, obesity, significant overweight puts you at higher risk for mortality as well as morbidity, okay?
And I just answered someone's question. Yep. All right. How much of a difference does early medical intervention make in outcomes?
Huge. It's huge. So the earlier your intervention that you have, your ability to do contact investigation and get those precautions out to people and self-quarantine them and do those kind of steps inside the house. If some people, they don't have the luxury of going to another home or going to a hotel or whatever. So what are those things you can do inside the home when you can't move individuals? That antiseptic solutions or precautions, what do you need to do? That's really important. And, we try to provide those resources for folks who can't afford it, to help them inside their homes if they have an outbreak. So I think that's just really critical. And it cuts down your cases significantly. But once it becomes community-wide spread, it's sometimes hard in order to detect pockets where you starting to have outbreaks, and the earlier we can reach it, the better. Take a look what happened at Tyson's Farms in Cass County. Almost over 80% of the workers in that plant were positive for coronavirus. And I think because of lack of testing there, they didn't have the ability to test people when they were getting sick. And here's the thing that's the most frightening of all. I'm going to say this. What's the most frightening of all? That we now realize there are about 30% of individuals out there who are positive, but have no symptoms and never develop symptoms, but they're just as contagious if they're talking to you and they're within 3 feet of you and they're talking, especially if they're inside, that they can spread the infection to you. Just regular talking produces respiratory droplets in the air. And so if you come within that space before those respiratory droplets drop to the ground, you can inhale it and become infected. So we now know we've got folks who are asymptomatic, and so that's important to know in the difference.
One more question here from the audience. Someone's 66-year-old mother still sees her great-grandchild who's 1 year old wearing a mask, wearing a face mask. Is she risking her health?
So she's probably okay as long as she's wearing a mask and she's very careful about what she touches inside the home, and she's doing frequent hand washing. So and she's got to make sure that she's seeing her grandbaby, but she needs to wear a mask. But it's helpful if she's visiting wearing a mask that all the others are wearing the mask at the same time while she's visiting inside, whoever's inside the home.
That's right. All right. Finally, we are tired. As Black people are disproportionately affected by COVID-19, racial injustice, unemployment, educational opportunities, housing inequities, the list goes on and on. What tips and tools do you have for us to maintain our mental and our physical health?
So I think that, guys, I need all of us to be advocates, okay? We have to change health policy, and this is our best opportunity to do it by being active, okay? So what do I mean by that? I will just tell you these are my personal reflections, not my health department, not the mayor. I'm only talking about myself personally in terms of my viewpoint. I think we have to address the poverty. I think that's a critical area that needs to be addressed. And I think the easiest way to address that is, we're hardworking people. There are folks that we work hard. So that's not the issue with us. So I think we need to work on getting past a living wage. So have enough money that I can pay for my food, utilities, transportation, childcare, if I have any children, and just enough to pay for medications if I need to have it for my medical care. So my number one thing is let's pass minimum wage. And for all you guys who are sitting out there on the couch, okay, I need you to contact whoever your representative on state legislative, your state policymakers, your local city council members. I think we got to make it happen. Now, do I not realize that unfortunately some small businesses may close because they just say, hey, I can't keep my business open if I have to pay someone a living wage. And a living wage, I think, for Marion County is around about $13 an hour. So the living wage, or it's somewhere between $11 and $13 an hour. And so, yes, we may end up having some small businesses that may not be able to survive being able to pay their employees, but we've got to go to the next level. And sometimes going to the next level, it's difficult. But we also got to say and fight for rules that are put out. All that stimulus money, what? My goodness, how much billions of dollars in that first round that got put out? But hey, the Harvards, Yale, Amazon, all those folks, their bankers are calling them. It's not them calling their bankers to say, hey, I've got this application form. I'm going to send it to you. Please fill it out so you can get some of the stimulus package. But for African American small businesses, okay, they don't quite have the same relationship with their bankers like this. So, wow, what happened? Why did none of them, hardly anybody, able to get part of that stimulus package? So do you know what? The Department of Labor waived affirmative action in giving out this money. What did I say? The Department of Labor waived affirmative action regulations relating to this money being given out. And so none of our smaller businesses, white or black or any other racial deals, were being heavily impacted negatively compared to the big corporations, and how some of these large organizations were considered to be small businesses is beyond me. But we've got a lot of these areas where you can bypass certain rules. And so we've just got to make it an honest playing field and work on that and just say, we want it to be an honest playing field. And we don't like that you did this. This was unfair, okay? And so we need to talk to our policymakers to say we were unhappy with this. But education, education, education. We've got to make sure we are graduating our children, that they're getting a high school at least degree, that they have to have a minimum education level to get the higher paying jobs, but also to understand the message that we're putting out. And we've got to involve these different racial and ethnic populations leadership in terms of partnering with them to talk about what's the best way, how to communicate and get the message out. But give them the tools to be successful. We've got to give them the tools to be successful. And so Warren Buffett, Bill Gates, folks out there, someone win a lottery ticket, please help to give those resources. But poverty, poverty, poverty is something that we need to address. And mental health. That's my number one thing, mental health. Okay, we got to address that mental health that's associated a lot of times with the poverty and people self-medicating themselves, okay?
Dr. Caine, that was amazing. You answered all of our questions. I truly appreciate your time. Not to mention, this is your day off. So thank you for taking your time to meet with us here at Ivy Tech.
Well, let me just say, I am such a fan of Ivy Tech. You guys just do a credible job. I love your president and all the folks that work there. You're just doing a bang-up job, and we enjoy working with any of the students and graduates from your academic institution. Keep on doing the work that you do. You're just incredible, and you're a wonderful resource for us in Indianapolis. We always delight in partnering with you. We were just about, until COVID hit us, we were having our team summit where we were inviting teenagers from across all the school systems to meet at Ivy Tech. And so that tells you, of all the schools, who do we come to partner with? That's Ivy Tech, because we love you. So keep up that great work, all of you do. But be an advocate, be vocal. And if you just help one person, you touch one person, you've done a remarkable job for our community. Thank you so much for having me.
All right, attendees, if you would like to submit any questions, comments, concerns, or feedback, please email us at diversity@ivytech.edu. I just wrote it in the chat. We value everyone's opinions, and your feedback will be helpful as we determine our next programming. Again, Dr. Caine, this was remarkable. We truly appreciate you. We look forward to a continued partnership with the Marion County Health Department, and thank you all for attending.
Well, thanks again, Denisha. It's always a pleasure and honor to provide any kind of service for you. Just appreciate you spearheading this effort. And I just appreciate every one of you who are interested enough to hear and understand about the complexities related to diversity, because it is huge, our health equity, whether it's seniors, different racial, ethnic populations, whether it's poverty impacting us. There's so many vulnerable populations, and we're going to try to do outreach next to the Burmese population, who's huge in our community. Thank you.
Thank you. Bye.